Hi, I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on all sorts of sports and exercise injuries and injury treatments and injury prevention for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. Now, April is Youth Sports Safety Month. We're kind of getting toward the end of the month, but it's really a time to kind of step back and think of what we can do to keep our kids healthy as they play soccer and baseball and football and gymnastics and cheerleading and lacrosse, all these sports, and there's others obviously, but ways to keep them playing sports but keep them healthy. And one of the questions that I get from parents sometimes, and sometimes coaches as well, is what do we need from a medical standpoint available? Supplies that we could have available so that if something bad happens, we'll be prepared. It's a terrific question. This is always a good thing to think about before an injury occurs or before an illness or even an emergency occurs. So I think it's a great question to ask. The first thing, and this really gets way beyond just a list of supplies, and I've talked about it in other tips, but I'll mention it here. If there's any way possible that you can have an athletic trainer available at your practices and at your games, they are qualified medical providers to evaluate injuries, certainly to be first responders in an emergency. They are invaluable resources to have. At the high school level, we've got, I think, about 70% of high schools have some sort of access to an athletic trainer. Not good enough, but at the youth sports level, it's not clearly enough. That's a topic for a whole different discussion, but they're terrific and we need more athletic trainers there. And along the same lines, it'd be great to have EMS or ambulances, paramedics at a youth sports event, but let's be fair, it's hard to guarantee that they're going to be at high school events and college events sometimes because there's other emergencies going on. So guaranteeing that they're going to be there at a youth sports practice or game or tournament, that's pretty unlikely as well. We love it, but we can't rely on that as well. And yes, you can call them if something happens, but again, that gets back to what we're here to talk about. What can you have on hand should something happen? So I've talked to a friend of mine that's an emergency room or an ER physician that works with a lot of not just pro and elite sports, but at the youth levels as well. And he gave me a couple things to suggest, and I've served as a team doctor, so I know this kind of thing as well. But things like cervical collars in case there's a neck injury, things like splints, moldable splints. So if a kid breaks his arm, at least you can stabilize it, while he goes to the emergency room to have it treated. Things like gauze rolls and padding and bandage supplies, in case a kid gets a laceration, deep cut, something like that, an open wound, that can be really helpful as well. I think in a bigger picture sense, either the team has one or certainly whatever facility you're practicing at or playing at, make sure there's an AED, the automated external defibrillator. Cardiac conditions can happen as kids, commotio cordis, getting hit right on the chest with a ball, or there's all sorts of other heart conditions that can cause sudden cardiac death. So know that there's an AED there, know where it is, check it out periodically, make sure the batteries are working. You'd be surprised how that can happen. So know where it is and how to use it, and make sure that it's working properly. Another thing that I think is really important is to have a plan. Have the coach have this plan, but also everybody involved have this plan. So know the location and maybe the phone number of the local hospital in the emergency room. You can call and tell them you're on your way, but everybody will know, what hospital that kid's going to go to, how to get there, that kind of thing. A chain of command in terms of people to call can be really important as well. A list of maybe medical illnesses of all the kids on that team. What if somebody's got a significant allergy, maybe to bee stings? That kid should have the epinephrine injector in case he does develop an allergic reaction and you need to treat something suddenly. But you need to know what all kids have, so one, that you can expect it, deal with it, but also be able to tell the paramedics when they show up. I think all of that can be very important. Now, if you're a parent of a young athlete that plays sports, or maybe you coach youth sports, Are there other things that you have that I didn't include on this list, or do you find a challenge in having some of this? Do you just rely on calling an ambulance should something happen? Or if you're a healthcare provider, are there things that I forgot to mention? I talked about athletic trainers, so they're really, really important, but are there supplies, whether or not you have an athletic trainer, that would be helpful? I'd love to hear your thoughts. So below this video, leave those comments. I'd love to hear them, and obviously it would help other people whose kids that play sports, maybe give them some ideas of things that they need to make sure that they have. Now, if you like information like this and want more information on injuries and injury treatments and injury prevention in sports and exercise, subscribe to my video channel. I'd love to deliver videos like this, because I record a couple of them every single week. I'd love to deliver those directly to you. Finally, go to my website, drdavidgeyer.com, and enter your name and email list. There's so many resources, free resources that I create on ways to stay healthy and perform your best that I only share with my email subscribers. So enter your name and email address, and I'd love to get those to you on a regular basis. Thank you so much for watching. I think this is a really important topic, so definitely leave your comments and share this video, and I look forward to seeing you right here next time.